detrimental effects of hyperoxia, or having too much oxygen. There are some key physiologic effects. You have systemic vasoconstriction with too much oxygen, particularly in the muscle vasculature, which can increase your systemic vascular resistance. This can decrease your cardiac output, especially if you have impaired cardiac function to begin with. Too much oxygen also causes excess dissolved oxygen in the plasma, leading to increased reactive oxygen species, which can increase oxidative stress on the body. There's some clinical concerns. You can have impaired oxygen delivery to tissues despite having high oxygen levels if you're impairing your cardiac output, for instance, and hyperoxia can exacerbate underlying cardiomyopathies. In the pulmonary system, you can have pulmonary vasodilation, which can paradoxically increase your shunt fraction, or the amount of blood that goes to your lungs but does not participate in gas exchange. You can also have cerebral vasoconstriction. In newborns, the dangers of hyperoxia are even more prominent, with sequelae like retinopathy and chronic lung disease. There's some important context behind this. Humans have evolved mechanisms to deal with hypoxia, but have not evolved mechanisms to deal with hyperoxia, because it's not really present in nature. The effects are largely unregulated once hemoglobin is saturated, and the benefits are marginal once hemoglobin is saturated. The current evidence does not show an impact on surgical site infections or mortality of hyperoxia, but these clinical concerns and these physiologic effects still hold.